Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you another COVID-19 community briefing on this January 12th day in the year 2022. I wanted to provide a quick update of our COVID landscape in the area, but the primary theme of this briefing is to talk about our walk-in clinic and our COVID-19 testing methodology. And we're going to have an announcement on that at the end of this briefing. First of all, there's plenty of COVID still out there. There's no question about it. At the state level, for the state of Iowa, we have 923 patients currently in hospitals with COVID. 178 of those patients are in the ICU. The state rate has a positivity right now of 21.2%. Relative, a little closer to home here, at Orange City Area Health System, in the month of January to date, so 12 days, we have 201 positives so far out of the 605 tests that we've conducted. So at this point, we're running at about 33% positivity rate, but you got to match that up with the volume, and that does represent over 200 people just in this month already tested positive for COVID. Lots of it out there. We're not sure if it is the Delta or the Omicron yet. It's very difficult for us to get the results that determine that. The assumption is primarily that it's Omicron at this point, and that does come into play relative to monoclonal antibodies and therapeutic treatments. But that's the best information that we have at this time. In terms of back to the state of Iowa, 70.6, so rounded up 71% of Iowans aged 18 and older are vaccinated. That number has been creeping up a little bit all along. Those not fully vaccinated account for 78.9% of those patients in the ICU in Iowa. So 79% of those 178 patients currently in the ICU are unvaccinated folks. Nearly 73% of the patients in Iowa hospitals with COVID are unvaccinated. So clearly that number is staying there in terms of unvaccinated folks are not faring nearly as well in terms of hospitalizations and ICU stays. Also, kind of an alarming rate is the number of long-term care facilities in COVID outbreak status. That number is currently 41 in the state of Iowa. Fortunately, at this time, Prairie Ridge is not one of those facilities. So we have been very fortunate as not to have positives in our nursing home for some time. We are having some staff positives, but fortunately with the protocols in place, we've been able to kind of dodge that bullet for now. So that's a bit of a quick tour of the Iowa landscape and a little bit locally. I do also want to follow up a little bit with the Sanford infographics that if you can find that, it's Facts Over Fear infographic that Sanford puts out. And this is about a week old, and I know they're going to be updating this, but the point is still the same. In the Sanford owned hospitals, so that's not including Orange City, but in all their own facilities, as of January 4, there were 201 COVID patients, 201 hospitalized patients with COVID. 176 of that 201 were unvaccinated. So only 25 of those 201 were vaccinated. As of January 4, 64 patients were in the ICU. Of those 64, 57 was unvaccinated. Of those people in the ICU, 51 were on ventilators. 46 of those 51 were unvaccinated. So again, very clearly, and these statistics have been very consistent, is that being vaccinated doesn't make you bulletproof, but certainly minimizes the severity of the disease. So as a result of that, again, vaccines and boosters are highly recommended, primarily as a means of minimizing the severity of the virus, but not avoiding it. But if you do get it while vaccinated, the chances of you being less sick are much better if you've been vaccinated, and even better if you've been boosted. Also continue to wash your hands, use other common sense kinds of things. But again, to reemphasize, live your life. Let's get about doing the things that we normally do. Let's just be smart about it. Get vaccinated, get boosted, try to use good hand hygiene, that kinds of thing, and live your life. Okay, enough of that. Let's talk about walk-in clinics and testing. Walk-in clinics and urgent care clinics are around the area. None of them are perfect. Some of them see all patients. Some require being seen in the last 3 years. Some even require a negative COVID test before being seen. Our walk-in clinic is one of those that sees all people, but quite frankly has been overwhelmed with volume. Some of it COVID related, some of it not. But nonetheless, the walk-in clinic has been stretched beyond its capacity, at least in partial response. We are announcing a COVID testing site that'll be active 7 days a week here at Orange City Area Health System as follows. So I'm going to go through a few criteria. It may not be in the right sequential order, but we thought it's important to get these things to you as soon as we possibly can. First of all, this clinic will be effective this coming Saturday at 3 o'clock. We will run Saturday and Sunday from 3 to 4. We will run Monday through Friday from 7:30 in the morning till 9 in the morning. So again, Monday through Friday, 7:30 to 9, Saturday and Sunday from 3 to 4. These will all be in MB1, Medical Building 1, which is on the west end of our campus. Some of you might think of that as the physical therapy occupational building. That would be the right door to come in, but that building is actually called MB1, and that's where the site will be. This will be a cash or check process. So cash payment will be required. There will be no EMR involvement, no billing of insurance environment either. It'll be $35, again, cash or check. We will not promise immediate results, but we will promise results the same day of testing. This is also while supply lasts. We are going to burn through all of the antigen tests. That's what these will be, antigen tests. Some call them rapid tests. We're going to burn through all of those that we possibly can and until supplies are gone. This is important to understand that this is not for travel. Please contact the occupational health department for specifics of your travel destinations requirement relative to COVID tests. As many of you know, there are many different tests. So do not use this site for your travel testing. That's pretty risky because it may not be accepted by wherever it is, the country or the destination that you're going. Again, for travel testing, please contact occupational health for specific direction. So basically, again, a rundown. These testing will start this Saturday. They will all be at MB1, Medical Building 1. They will be Monday through Friday, 7:30 in the morning till 9 in the morning. And it'll be Saturday and Sunday from 3 to 4 p.m. We would expect that there will still be some testing that needs to occur at the walk-in clinic, or maybe even at our regular clinic, more than likely our regular clinic. But those will all be under the direction of providers. And so please continue to schedule. If you're concerned or if you need to follow up, please contact the clinic for those services. Also in the future and beyond the alert for this, we are being advised that we may be receiving some free at-home tests that we'll be able to pass out to folks to be able to test yourself at home. These will be a rapid test that you could figure out in very short order at home. When those become available, assuming that they do, we will make sure to provide you with that information and get those tests out to you as soon as we possibly can. Backing up to then the supplies of the MB1 testing site. We're going to go through them all as quickly as we can. We're not going to hold anything back, but when they're gone, they're gone. And we are at the whim of the government for being able to get us some more of those tests. Those are free tests. And so what our $35 covers is simply the administration and collection of that specimen. So when they're gone, they're gone. So please have some understanding with that too. We think we have a decent supply, and so that's where we're going to stand on that. I think that's it for today. I just wanted to let you know primarily on the testing. I'm going to repeat it. Monday through Friday, 7:30 to 9 in the morning at MB1, 3 o'clock to 4 o'clock on Saturday and Sunday, again at MB1. Please try to use that site or those days as the primary source of testing. That will relieve some pressure from the walk-in clinic as well as our regular clinic, and so we can get more folks seen in those venues if folks use these protocols at the testing site. This is a long journey, and it is still a journey, unfortunately, that we're on. We appreciate the trust and confidence placed in us. We appreciate the grace that's been extended to us. We're all getting a little crispy in terms of our margin getting thinner, and I think society as a whole is as well. But we're hanging in there together. Appreciate all the work of our staff and appreciate the loyalty of our patients. And we thank you for that. Until the next briefing, take care and be safe out there. Thank you.